Hi, my name is Kathleen, and in this presentation I will be discussing different types of fractures we see on X-ray. So to start with some fracture basics, first we'll talk about open versus closed fractures. Open fractures, bones break through the skin or have a deep wound that exposes the bone, and a closed fracture is a fracture that does not break the skin. So in this picture on the left, you can see this open fracture of the proximal right femur. This is actually from a boat propeller injury. So this is it doesn't extend out to the skin, but this wound exposes the bone. And then incomplete versus complete fractures. An incomplete or a partial fracture is a fracture that doesn't cross the bone completely, so you'll only have one cortex that is broken and the other one will be intact. And then in a complete fracture, the fracture line extends all the way across the bone. So in this middle picture, you can see an incomplete fracture and how that fracture line doesn't go all the way across both cortices. And then on the right, you can see this radial fracture where the fracture line extends all the way across the bone. And then just another characterization of this right radial fracture on the side. This is also displaced, meaning that there's a gap between ends of the broken bone. So some examples of complete fractures include transverse, spiral, and oblique. On the left, you see an example of a transverse fracture in the radius. Typically, transverse fractures are perpendicular to the axis of bone, and they are usually in long bones, such as the femur, tibia, both bones in the forearm, and then these also have a pretty high risk of displacement, so usually those two ends, proximal and distal of the bones, don't line up very well and require reduction. A spiral fracture results from rotational forces and high force trauma. So, if your foot gets stuck in something and you twist your leg around really hard, you get kind of a spiral fracture in your tibia, and that's what we see below here. You can see it's a complete fracture. It goes all the way through both cortices of the tibia, and almost always this spiral shape. It has a diagonal approach through the long bone, kind of showing that rotational force, usually the result of a high energy trauma, and also pretty likely to be associated with some displacement. This picture here of the spiral fracture isn't too displaced, but they can be a lot more displaced than that usually. Oblique fractures, such as the one on the right, also typically occur in long bones, so bones in the forearm, tibia, femur. These are kind of similar to a spiral fracture. They're kind of oblique to the axis of the bone, and they're also quite prone to angulation as well in plane with the fracture. Spiral fractures and obliques can be pretty difficult to distinguish, just to keep an eye on that, but usually spirals are from more of a high force trauma. Next, we're going to talk about types of incomplete fractures, first one being a green stick. These are often seen in children under 10 years old, typically in the long bones, mid-diaphyseal, typically in the forearm and the lower leg. And these are often incomplete fractures, meaning the fracture line doesn't go all the way through the bone. Typically, the fractured segment of the bone is the convex surface. There's typically an angulated longitudinal force applied down on the bone, which is why these are often called bending bone fractures. Next one being stress fractures we'll talk about. These are often a result of chronic mechanical stress or mismatch of bone strength. So typically these types are seen in runners, military recruits, women, and especially elderly women, just because they have weaker bone. More often seen in the lower limb than the upper limb, and these are really hard to see on X-ray. MRI is a lot more sensitive to see these stress fractures. On the right, in this MRI image, you can see that area of hyperintensity within the bone, showing the area of where this stress fracture is located. Some other fracture descriptors include segmental, comminuted, and avulsion fractures. First thing being segmental fractures. These are having at least two fracture lines isolating a dominant fracture fragment. So on this leftmost image, you can see that the bone is broken in two different places. And you can see that that piece of femur there almost looks like it's just floating around completely independent of the proximal and distal segments of the femur. These segmental fractures are usually high energy mechanism injuries, usually from something like a car crash. And then that segmental fragment is at pretty high risk of devascularization and not having any blood flow to that bone. So fractures like these, increased risk of morbidity, increased complications of infection from not having any blood flow, non-union, delayed union also as a result of that lack of blood flow, helping the bone heal and reform into its original shape, or at least close to its original shape. In comminuted fractures, these are usually when someone says a bone is shattered. In common terms, there's numerous fracture lines, more than two. Several bone components are creative. They're a really heterogeneous group of fractures. These are similarly a result of a high energy trauma, whether it's a car crash or a fall from a really high height. In this middle image, you can see that the tibia and the fibula are just broken in so many different places, and there's just so many different fracture segments, and it's just a really messy fracture all around. Third thing being an avulsion fracture. On the right, we can see this ASIS, anterior superior iliac spine avulsion fracture, where just a little piece of the bone gets ripped off of the bone, just a little piece of that cortex. These are usually fractures at sites of muscle or tendon attachment. Usually a sports injury in a younger person, but it's a high tensile force from an extreme range of motion or just a really high muscle activity. That muscle will tear and take a piece of the bone with it, and that's what causes these fractures. Really common sites of these include the knee, the shoulder girdle, the elbow, the ankle. So you'll see these really commonly in sports injuries, and it'll just be a little piece of the bone that came with the muscle or the tendon attaching onto the bone.